A very, very warm welcome to each and every one of you joining us today. On behalf of the FORESIGHT Global Health team, I am Ria Lobo, and I'd like to extend a very warm welcome and thank you all for tuning in for this very exciting project that we are about to launch called the FORESIGHT Global Health Talks. I think I speak for many people, and we are all ready to bounce back from 2020. It's been a particularly hard year. And what better way to do that than to talk about how we strengthen our healthcare systems so that we can better deliver healthcare, NCD healthcare, for the very people who are affected by NCDs. I do not want to take too much time, and we have an amazing panel with us today, and I'm going to jump right in and introduce them. I'm so grateful that we have Professor Joseph Mukhambotsy, who has joined us all the way from Rwanda. He is the Vice Chair of the East Africa NCD Alliance. He's the Chief Consultant, Pediatrician and Cardiologist at King Faisal Hospital, Kigali, and Associate Professor of Pediatrics at the University of Rwanda. He holds an MMED in Pediatrics, a Fellowship in Pediatric Cardiology, and an MSc degree in Clinical Research from the Catholic University of Louvain in Brussels, Belgium, where he's worked for 10 years. You know, to be honest with you, I think I can go on with Professor Joseph's very impressive resume for the rest of the webinar. But to keep it short, he has also worked closely with the Ministry of Health and the Rwanda Biomedical Center on the national NCD policy, strategic plans, and NCD protocols. That's a pretty hard profile to follow up on, but we have an equally impressive profile in Dr. Christian Kræf, who is joining us today. Christian Kræf is a scientific advisor at the Danish NCD Alliance. He is a medical doctor working in internal medicine at Riis Hospital in Denmark. He holds a research doctorate from the University of Münster in Germany and an MSc in epidemiology from the London School of Hygiene and Tropical Medicine. Christian, in his role in the Danish NCD Alliance, also supports the East Africa NCD Alliance in planning and conducting NCD-related research projects. His interests lie in improving patient-centered healthcare, which we love, particularly in primary healthcare, for patients with both NCDs and communicable diseases. Thank you both for joining us today. We are so excited to have you on board. And
thank you for inviting us.
Thank you. And you're most welcome, because I think this conversation is so well-rounded by having two experts in this field from two different parts of the world. And we're really grateful that we have you with us today. So I want to just jump right to the questions. And my first question is going to be to Dr. Joseph. Joseph, how important are primary healthcare systems in the overall efficiency of health systems?
Thank you very much for this interesting question. There's so much to say, but primary health care is the backbone of any health system because it is a comprehensive approach to deliver care to all during the whole lifespan of someone. It includes not only prevention, but also treatment and up to the palliative care. And such an approach is necessary to make sure that you avoid any inequalities in providing healthcare to a population. So without primary healthcare, you will just remain with specialized care for, let us say, those who can pay for it, but will not cover the entire population. And it includes very, very essential basic services like immunization, for example, like hygiene, so it is so broad, but it is also very much rooted in the concept of health as a human right. And I think that's explain why it is so important.
I'm so happy that you brought up human rights in this conversation, because many a times people don't think about health is a human right. And thank you for bringing that up, Professor Joseph. And I'm going to ask the next question to Christian, in fact. And I think this is interesting. This is an audience question. So this came in a form that we sent out before the event. And I found this question extremely interesting. It goes like this. Fighting NCDs is for all: policymakers, healthcare professionals, people living with NCDs, and civil societies. To this person in the audience, he said that to him, this is only in words, because people living with NCDs are not fully involved as key partners in this fight. So the question goes on. It's actually 3 questions, and I'm going to break it down for you, Christian, so that you could answer each question at the time. So Christian, do you believe that NCD patients, if empowered, can play a great role in reducing the prevalence of NCDs?
Yes, I think that's an amazing question, because it actually pertains to something that is very important, and that is in chronic diseases, which a lot of NCDs are. The patients are actually experts of their own diseases, often more so than their physicians, who know a lot about a lot of things, but not necessarily as much about the single disease the patient is affected with. So definitely the patients are experts, and healthcare and interventions only really work well when the patient perspectives are included in the planning of interventions in healthcare. So definitely.
And what do you think, and this is the second question, in fact, what steps are needed to create a system that can bring peer-to-peer education to enhance change in NCDs?
Yeah, I think that the point also that Joseph mentioned, human rights, is a very, very good keyword here, because if you look back at the HIV AIDS response, it only really became so successful because it took a human rights-based approach, and it was patient driven. And I think if we can kind of percolate that, use that for this platform or similar platform for the NCD response, I think this would really be a way to accelerate the current debate and attention given to NCDs. And then the next step, as I mentioned, to the response to the first question, I think patient-reported outcomes and patient priorities are something that is coming up in healthcare research and healthcare planning. But I think that's something that civil society and patient organization should really be pushing for, to ensure that the patient priorities and perspectives are taken fully into account, because they can be totally different from the healthcare providers or the health policy planner perspectives.
That's super interesting, Christian. And I just want to ask Dr. Joseph to come in here and just share his thoughts on this, because I mean, do you believe in the rights and responsibilities of people living with NCDs? And you know, what is the system that is required to bring about this peer-to-peer education to enhance change in NCDs, Professor?
Thank you very much. Actually, I'd like to insist on the first. So people living with NCDs, first of all, have the responsibility of themselves, meaning that you can prescribe what treatment you want. If the patient doesn't understand, doesn't participate, is not compliant, it will not work. So it is very important to empower the patients in understanding, in learning about the disease, and most importantly, groups of patients are going to help them to empower each other, to support each other. And giving an example, when we conduct heart surgery here in Rwanda, we call patients who have gone through it, and they come to reassure the new patients about the future, about the operations. So it is very important for all groups of patients. It is true for cancer patients, it's true for diabetic patients. So that's the first responsibility, I think, and where the role of people living with NCDs is very key. The second role for me is the very important role in terms of advocacy, because civil society can advocate for better management of diseases, but it is better when it is done with people living with NCDs, where they're the one to know the hardship they go through. They are the one to go to know what are the different barriers they meet. So for me, those should be the two key roles. And I think that's the role of the civil society, like the Rwanda NCD Alliance and the alliances in the different countries, to bring together the patients, empower them so they can speak with a loud voice about their rights, about their needs.
And Professor, you raise an extremely interesting point here, because I think many a times in public health, people don't distinguish between civil society and affected communities. They put them all under this one bracket that, okay, this is civil society and affected communities, that is one space, but they're very different from each other, like you rightly said. And to involve the affected communities in this process of advocacy, you think there need to be more formal channels involved, and what would it take in order to get there? So how do we create these structures so that we have communities lead the response?
So both people living with NCDs groups and the community at large have a role to play. And I think the people living with NCDs can be formally involved. To give an example, in my country, we have a national technical working group on NCDs, kind of consultative committee. And the different patients' organizations are involved in that committee. It means that even when we are talking about strategic planning, representatives are there. And ideally, we should reach a point where even the parliament, even in the different assembly, we should have representatives of people living in NCDs. That's a dream. But then the community at large has a very key role to play, because that's where comes education. Because, and I would say, again, an example from my country, the community health workers are simple citizens. Everyone is responsible of his village. So in the village, you have 2 or 3 of them. They are responsible for making sure that children are immunized. Those kind of different activities, and they are not paid for, but it is a civil responsibility in the community. So I think that's 2 levels of responsibility.
That's really interesting that you say that, Professor. And I think having the community lead the response is a super important part of what we do, and we need to create those systems in order to do that. I'm going to get back to Christian, and again, it's a follow-up on that question which this audience member has asked. And what are the future plans that you have to make the community and civil society as key partners in this fight?
Well, I think it depends a bit on what context and setting you're thinking about in the first place. I think, for example, as far as I know, in East Africa, there are a lot of community outreaches going on that sensibilizing people. But I think what is also very important is to research has been focused, when it comes to NCDs, has been focused very much on quantitative studies, randomized controlled trials, for example, to investigate new medicines. But what is even as important, or even more important, to make the NCD response successful is to conduct qualitative research, for example, look at knowledge, attitudes, practices of NCD patients, and use anthropological methodologies, sociological approaches to really understand what is going on in the societies and among patients. I think this would really bring the whole agenda step forward.
And Christian, I'm just curious, because this is a question I had in my mind pretty much as soon as we had this webinar live. And the question really is, problems with health systems are often associated with developing countries. I mean, rightly so, because they have weak healthcare systems, and in low and middle income countries. So can problems with health systems be actually present in developed countries? And how do you see this happening? In what way?
Yes, the answer is, of course, a lot of problems. I think that actually some of the problems are very similar, and that is, for example, the health workforce shortage. Of course, there are different dimensions when it comes to health workforce shortages in for example, Sub-Saharan Africa and Denmark. But in the issue, it is still an issue in Denmark also, because people are concentrated in physicians, nurses, health workers are concentrated in affluent areas, in highly specialized care among rich patient groups. And in, for example, here in Copenhagen, there's no shortage of doctors, of course, but if you go to the periphery of Denmark, if you look at primary healthcare in Denmark, there's also a lack of qualified physician, nurses, and other healthcare workers. So that would be the first issue, I think, that healthcare systems all around the world are facing. That is the health workforce shortage. And the second point is fragmented care, especially in highly developed healthcare system, that can become an issue, that patients have to patients with multimorbidity, different NCDs, have to see a physician for diabetes, a different physician for lung disease, a different physician for their cardiac disease. And in that case, we come back to the very first question that you asked, and that is, how can you integrate and coordinate the care? And that is, again, primary healthcare that can do the job. And some developed countries have well-developed primary healthcare systems, and some do not. But I think in general, that is also a shared challenge we have with less developed countries. The quality and availability of primary healthcare.
It's very interesting, Christian, because I think your first point about, having healthcare in rural areas and other parts in the countryside, having good, adequate healthcare is a challenge, and more so in Africa. What do you say, Professor Joseph? Do you share the same thoughts?
I would say that yes, both systems have problems, but they are completely different, because we suffer from not enough workforce, not enough trained, overwhelmed workforce, but also very poor availability of specialized care and specialists, of infrastructures, of so it's so different. But also, in some way, maybe we have still a chance to build a better system if we start by strengthening primary health care, because that's where is the key of the system. So, and I think that having a family doctor for each family and village is maybe not the right way to go. If we think that there should be first community services, which should be strengthened, should be available and accessible to all, then eventually a family doctor for a bit more specialized on care. Because I have the impression that, having lived in Belgium, that the family doctor has, yes, a key role, because he knows the whole family, he knows the children, he knows the parents. But on the other hand, somehow there are community services which he cannot cover. And I think maybe we should think in our countries to take it differently. That's what I believe. Now, in terms of workforce, we are obliged, and that's what we are doing, to shift tasks. Because we don't have enough doctors, not enough specialists. Like in my country now, NCD clinics at the district hospital are run by nurses. We train them 2 months, We teach them even to do some basic ultrasound, and they treat patients. So we have no choice. We need to do that. And I think task shifting should be one of the things we could recommend in many countries to do that, because training the specialists will take so much budget and time that to be different. But anyway, so yes, we have a lot of problems which are also linked to funding and to infrastructures, and we still have a long way to go.
Yeah, and Professor Joseph, I think the point you raised about, you know, our healthcare workers in particular, I mean, they're pretty much overburdened anywhere in the world at this point. And I'm going to take this question to Christian actually. Overburdened healthcare systems is a huge challenge across the world. And how are they? And they're always expected to take on more healthcare workers. So how do we address these challenges, Christian?
Yeah, I think that there are different levels, layers to this question, and one is that the issue that Joseph mentioned, and that is the lack of healthcare workers, the absolute lack of healthcare doctors in a lot of regions in the world, up to 18 million according to the World Health Organization that are needed currently. And another important point I would like to raise is that 70% of the health workforce are women, which are often in informal employments, and they are not necessarily as well paid or paid at all as they should be. So this could be some important first steps to recognize that we, first of all, governments have to invest into educating the right amount of workforce, and to pay and create the right work conditions for all members of the workforce. And then the other really important point is that also that Joseph mentioned already, in fact, is that how can we create the right healthcare team, who should take which jobs, who the person that can do the job best should do the job. And that means building healthcare teams that maybe consist of as a physician as the coordinator of care, but has nurses, has other healthcare workers, and especially community health workers that then can multiplicate the knowledge and the coordination of care coming from a central entity. That would be one very important approach, building the right healthcare team and making use of community health workers. And the other point, of course, is to prioritize. I mean, it should be, one thing is of course to take into account patients' perspectives and priorities in a coordinated way, but then again, should be in the face of limited resources, you should look at what are the highly effective and highly cost-effective interventions and elements in a healthcare system, and to use them first. I think that this often the 80-20 rule is true also in healthcare. You can often achieve 80% of the outcome with only 20% of the resources, and I think that's important to have that in mind.
Yeah, and Christian, and thank you for raising the whole gender lens in the way we look at healthcare to begin with, because I think that is a conversation we do not talk about enough at all today, and I think it's a very important conversation to have with respect to bettering our healthcare workforce, so that make sure that their well-being is taken care of as well. And I'm going to direct the next question to Professor Joseph. I think you would be the best person to answer this question. And if you could please share some of the best practices in the world in strengthening healthcare systems, and what can we learn from them?
Thank you very much. I just wanted to add something about what Christian said. I'd like here to mention the problem of brain drain, because even the few resources or health workforce we have in developing countries are being drained to the richest countries because they are better paid. And that's a shame. That's a problem. And of course, it is to our government to pay the workforce properly. But I've seen that even I heard recently that even in Sweden, some ICU workforce is leaving because they are overwhelmed. They are working too much, not getting paid enough for that. So we should value the work of our health professionals, and that needs to be discussed again, I think.
And the world is turning today. Sorry, I'm just to add, the world is turning today because of our healthcare workforce. I mean, they're the real heroes who are saving the world in the midst of this pandemic and any other disease. And they definitely require a lot more attention. Completely with you, Ahmed.
I think so. Now, coming to your question about the best practices, I think it is very difficult to find countries which are doing everything well. But as we talk about NCDs, I would like to mention Thailand in terms of tackling the NCDs and the financing NCDs. It is among the few countries which have been able to install tax on beverages, on tobacco, and other, so what we call sin taxes. And allocate part of those taxes or that revenues to fight and to prevent control NCDs. I think it is a very good example that we have been trying as the East Africa NCD Alliance to advocate for, but it looks like there is we need to fight against very strong systems because there are economic interests coming in. Because our countries, and it is normal, are getting a lot of revenues from those taxes. So that we have to be discussed and to continue looking at that. But it is, for me, one of the key orientations should give to our advocacy to make sure that financing of NCDs is at least covered particularly in our developing countries.
In the same breath, Professor Joseph, I would like to ask you another question. Should NCDs piggyback on existing infrastructure in other diseases like HIV and communicable diseases? And what are the pros and cons of doing so?
So that's something which has been, there has been a lot of research and publication around that. And yes, existing infrastructures for communicable diseases, not only HIV, but also TB, but also malaria, can be leveraged to ensure that NCD services are integrated. But there have been some criticism about the problems of stigma, the problems of because you integrate the NCD care in HIV services, for example, will have budget impacts on both and eventually decrease attention given to one and to the two diseases. So particularly in the side of HIV existing programs, you may have some resistances to integrate the NCD care. But what I would say is that it should be made case by case. It depends on the system and the country, because there are countries where you can do it and others where it may be difficult. So I think you cannot generalize, but the principle is that yes, we can build on existing structures to run NCD services.
Yeah, and in fact, I'm just wary of time. We just have a minute left, and I actually would like your closing thoughts on what the priority should be to build robust healthcare systems around the world. And I think, Christian, can you go in first so that we hear your thoughts as well?
Yeah, I think it's a lot about accessibility and that is in a geographic sense, that is in a mindset sense, but that's also in a financial sense. There should not be out-of-pocket spending when accessing healthcare. That's universal health coverage, basically. And I think what we also discuss a lot today is the patient-centeredness of healthcare that should be central. And I think that is also something that we can learn from the corona pandemic this year, is that if you introduce measures that people don't understand, or a majority of people don't understand, then they are not successful. So people need to be involved in planning. And the best platform to do that is primary healthcare. But just to make another important point that we didn't have time to touch upon today, I think the major challenges for health in our times, for example, obesity, still tobacco, alcohol, climate change, air pollution. I think these issues we can only really tackle those if we go to the root of the problem, and that is we need to think in multi-sectorial approaches. We need to go back and look at other sectors, at transport sector. We need to look at legislation in sectors other than healthcare, and so on. I think this is where we have to take a whole of society approach in reality to tackle the big challenges.
Thank you, Christian. And Dr. Joseph, do you agree? These are what the priorities should be?
You know, all can be prioritized. But to what yes, I agree with what he said. But to add something, we shouldn't forget about strengthening the surveillance and monitoring systems. Because if you have no numbers, you don't know what you have done. And you cannot advocate for raising budgets allocated to NCDs if you don't have good data collection systems. And cannot do any research without that. The other thing is we should insist more on, in fact, universal health coverage. And NCDs, yes, you can integrate NCDs packages in universal health coverage, but for that you need to have a good universal health coverage system. And both have to go side by side. And I think that I agree with the multi-sectoral need for coordination, but it's not only coordination, it's about having every stakeholder on the table. When you start discussing about fighting all those risk factors, you cannot do it if you don't have all the different involved stakeholders around the table. When you talk about indoor pollution environment, you need to have those people around the table. The same to avoid injuries, you need to have the infrastructures and the police around the table. So that high level coordination mechanism is really needed, and in many countries we are not yet there. And I think it should be one of the priority in our advocacy.
And I think that those are super important points that you raised, Professor Joseph. And on that note, I have a lot to take home. This was a very insightful conversation between both you and Dr. Christian. Thank you so much for joining us. It has been an amazing premiere of FORESIGHT Global Health Talks. And I look forward to having more insightful conversations with both of you very soon. Thank you very much for giving us your time. I know, to be a doctor in this time and give me half an hour is so precious. So thank you very much.
It was our pleasure. Thank you.
Thank you.